Now to more disturbing numbers in the coronavirus pandemic. We have set yet another new record for the number of Texans who are hospitalized with the virus. There are now 13,921 people in the hospital. That's 137 more than this time last night. And the reproduction rate in the Houston area, or the average number of people infected by one person with the virus, is now at 1.1. That's up from yesterday's 1.08. Remember, any number above 1 means the virus spread is increasing.
As the pandemic continues, health authorities are encouraging people to get tested, not once, but repeatedly, to make sure people are not unknowingly spreading the virus. Now, hundreds of millions of tests later, Channel 2 consumer investigator Amy Davis discovered doctors gouging patients and insurance companies for tests that are supposed to be free.
Nasal swabs, mouth swabs, rapid tests, and PCR. There's more than one way to get tested for COVID-19, and we discovered there are just as many ways for doctors to charge for the testing.
I paid $100 for me and $100 for my daughters.
Katie Hilborn also provided her insurance card at Clear Creek Emergency Room in League City in hopes she would be reimbursed when her insurance company paid the claim.
I called ahead. I asked what the fee would be.
Ruth Currian thought she asked all the right questions before getting a drive-through test here at the River Oaks Emergency Room on South Shepherd. She and her husband paid the $100 and provided a picture of their insurance cards as asked.
That's the only reason I provided my insurance, was I was, looking to get the $100 back.
But weeks later, both women felt sick when they opened their explanation of benefits.
$3,520 for me, $3,520 for my daughter.
$8,900 each person. Yeah. Wow.
Take a look. Ruth's insurance and her husband's were each billed $4,200 for emergency service and another $4,700 for ancillary services, paid in full by Anthem Blue Cross Blue Shield. Nearly $18,000 for 2 drive-through COVID tests.
I was just flabbergasted. I'd never set foot in the building. I spent maybe 5 minutes with the nurse through my car window.
On top of the $3,250 Katie's insurance was charged for herself and her daughter, came 2 more claims at $3,700 each for the doctor's services.
Which I never saw a doctor, ever, while I was there. They said, well, you talked to a doctor over the phone when you got here and asked you questions.
It's outrageous, and frankly, it's criminal behavior.
Niall Brennan is the CEO of the Healthcare Cost Institute in Washington, D.C. He said the CARES Act intended to shield consumers from the costs of COVID testing. But in the end, he says we'll all pay the cost of exorbitant claims in higher premiums.
Unfortunately, there is a small group of providers who looked at the provisions in the CARES Act and saw an opportunity to make a quick buck.
We want to talk to you about when no one with River Oaks Emergency Room or Clear Creek Emergency Room, both owned by Village Emergency Centers, would call us back. We dropped by and caught up with CEO Dr. Hortensia Luna Gonzalez.
So I'm wondering if you can explain why you would charge almost $9,000 for a COVID test.
We don't charge $9,000.
This is what you billed the insurance company.
No comment. I'm going to go.
The doctor was in a hurry to get away from me and the camera.
Some people say this is illegal, what you're doing. It's not illegal?
Our prices are posted on our website, so you can look at our website.
Their website reads no surprise billing, and this facility charges rates comparable to a hospital emergency room and may charge a facility fee.
These are drive-through tests. It's literally impossible for them to do many of the additional services that they say they're doing.
There are plenty of free COVID testing sites available all over the greater Houston area. Tax dollars are paying for the tests at about $60 to $90 each. The Texas Department of Insurance says unless it's an emergency, you should avoid going to a freestanding emergency room or a hospital for COVID testing. And if you believe that you've been excessively charged, you can file a complaint with the Texas Attorney General. We've got a link where you can do that on click2houston.com. I'm consumer expert Amy Davis, KPRC, Channel 2 News.
We reached out to Anthem Blue Cross Blue Shield, the insurance company that paid Ruth and her husband's claims. A representative told us they have conducted a thorough review of the case and that after Channel 2 investigates, contacted River Oaks Emergency Room for their story. The provider called Anthem to reimburse the more than $18,000 the company paid out. If you have a story for Channel 2 Investigates, you can call our tip line 713-223-TIPS or email investigates@kprc.com.